This is the new TC Pride Podcast, episode 24, part 3 of our 4-part series on transgender equity issues. TC Pride Podcast, we are on location at the Exchange in Minneapolis here with Gender Revolution 8, and I'm here with...
Billy.
Cal.
Andrew. I use he, him, or they, them pronouns.
Thank you. And so Billy, I'd like to start with you. Can you talk a little bit about the Minnesota Transgender Health Coalition, sort of in general, and maybe some of the programs and services that they provide to the community?
Yeah, MTHC, Minnesota Transgender Health Coalition, is the overall agency, the 501(c) that holds the Exchange and Gender Revolution 8 and all our other programs. And we've been around a little over 10 years. It was originally started by community members, both trans and cis, trying to make sure that there was health equity in the Twin Cities for trans folks. And I think about 3 or 4 years after they started, one of my friends and I started the Shot Clinic, which is now one of our main direct service of the organization, is our Shot Clinic and Syringe Exchange. And then we ended up joining up with MTHC and becoming their direct services. And from there, we've added tons of stuff like our gender gear program, our food shelf. We have several different trans-specific support groups. And then this last year, we also added trans-specific youth programming.
And one thing I wanted to ask you about, too, you were actually at the forum with Congressman Keith Ellison. And one of the breakout groups was about health issues and medical issues that are specific to the trans community. And I walked around and I was listening to some of the discussion. And wow, just from a point of view of someone that has no experience dealing with those challenges. Just dealing with insurance companies and that kind of stuff in general is tough. What are some of the specific challenges for people that maybe aren't aware that people within the trans community face when it comes to medical issues?
What our organization mostly focuses on is helping folks with more of their medical transition stuff, and then also hooking them up through our provider directory with doctors and different practitioners that are trans-friendly and or trans-specific. So there was some folks who were talking about at the Equity Summit about it's even hard to, if you have a cold, to find a doctor who will help you with your cold, because all they want to do is focus on the fact that you're trans. And so if you're trans, some doctors won't treat you even for a cold, because they're like, oh, I'm not a trans specialist. I don't know how that's going to interact with any of your other stuff, even if you're not medically transitioning. So a lot of the stuff we do is try to weed out who will actually work with our community, try to figure out all different kinds of practitioners that will do, and try to make that available to our community members. And then also our Shot Clinic and our Syringe Exchange, trying to hook folks up with learning how to do their shot, having somebody do their shot for them, and getting the clean syringes that they need, because that's not always provided equitably by doctors and pharmacies. Even if you have a prescription for needles, pharmacies won't always give them to you. So they'll give us our meds, but they won't always give us needles to inject with, because Minnesota state law says pharmacists have the right to decide whether they're going to give you needles or not, even if you have a prescription for them, because they assume everybody who needs needles is, especially the kind of needles we use, are injecting drug users. So we actually found when we opened that folks in other communities were having similar issues. We have several folks who come in who are also diabetics, who have nowhere to get needles because somebody decided they looked like a junkie, and they won't give them needles. They won't have places for them to drop off their dirty needles. So we do that as well in our Syringe Exchange, where people can drop off their dirties and then pick up new needles as well.
And so Cal, you also hold a leadership position within MTHC, correct?
That's correct. I've been with the board for about a year now. I first came to MTHC using the social support services by joining the general trans support group. So that was for gender and gender nonconforming and questioning individuals. And that actually helped facilitate my medical transition really well. So I've been with the board for about a year now. One of the things that stimulated me to join the board was my own experience of trying to proceed with a medical transition. My initial health insurance plan in I think this was late 2014 actually had this strange blanket exclusion where they had in small print at the front of their exclusion list said if something is listed as an exclusion in any section, it is actually excluded from the entire policy. So because transgender gender confirmation surgery was explicitly excluded, that actually meant that had my therapist listed gender dysphoria as my condition under treatment, that would not have been covered under my own insurance plan. So I've actually experienced not just that level of difficulty, but also a 6-month delay in beginning my hormone therapy, specifically because of prior authorization requirements. I've actually been taken off of my testosterone for over 10 days, and this year actually as a result of the prior authorization requirements as well. And that's like the least fun part of a medical transition is if you've started your hormones and you realize that yes, this really was the best thing for me medically, to then have to go off of those and then go back to that experience of what it was like living prior to transition. So, MTHC helped me out even before I was on the board. Just with, they had brought in navigators from MNsure to help us identify how to navigate that system online, which has been, under some, administrative and logistical change even since it's been implemented. Also helping to identify how to read the big, thick version of the health insurance plan, what is and isn't covered. How do you track down these specific prior authorization requirements for testosterone therapy or for estrogen therapy? What are the requirements for, what letters do you need and from whom for gender confirmation surgery? All of these things are, it's sort of the magical hoop jumping that we have to figure out on our own if we don't have a community-based resource to help us through that process.
Yeah, I mean, listening to the discussion at the forum, I mean, I was just thinking, it's like, wow, people, cisgender people who don't have to deal with a lot of those challenges, there's a lot of hoop jumping to begin with. And then you add being, a member of a transgender community, like all of the additional hoops that are added on top of that. And then Andrew, I would imagine being a member of the trans youth community, you just take all of those hoops and just like multiply them significantly, right?
Yeah, because they don't want you to make mistakes. They think that you're not sure about who you are. They don't want you to make a mistake with putting you on hormones and then later find out, oh, you're not really trans, but that doesn't really happen. I know when I had the same doctor from when I was born to when I was like 16 years old. I told her I was trans and she goes, oh, honey, I'm so sorry. And I was like, oh, no. I don't want to deal with this anymore. So I didn't go to the doctor for about a year, and I finally found a clinic, the HCMC Queer and Trans Youth Clinic. So now I go there for all of my primary care and transgender therapy stuff.
And Andrew, of course, is one of the members of the Gender Revolution 8 youth group. Can you talk a little bit more, Billy, about some of the youth programs that are a part of the Minnesota Transgender Health Coalition, please?
Well, I'm a youth worker and a teacher, and then I don't know what I am here at MTHC. Lead volunteer, that's what we'll call it. Shop clinic coordinator is my official title, but we all do 50 million different hats here. But so I really just wanted to, I've been doing youth work with LGBTQ youth on and off between being an art teacher for 20 years. And I just really wanted to work out of here, and I wanted to work exclusively with trans and gender nonconforming and intersex youth and work directly for my community. And I wanted them to lead it. That's very much how I do youth work, and I had just gotten out of working for a public school system for 3 years. Trying to implement that kind of youth work in a school system was really, really difficult because school systems are kind of the antithesis of youth-led. And we got a lot of good work done in there, and a lot of, they worked really well on their gender inclusion policies. And but, out of 5,000 employees, I was the only out trans person. There was definitely more trans folks there, but I was the only out trans person. And that was really difficult when I'm used to be surrounded by community. I'm also Puerto Rican, and there was very few folks of color, and there was very few men. And it was just very limiting. So I decided to quit my job there, and I was already working here full time anyway, doing shot clinic and everything else, but to talk to my board about adding on youth programming here, so we could make it not only specific to trans, gender nonconforming, and intersex youth, but have it led by them. So we wrote grants. We got one tiny one, which was really exciting, and we split it up between 3 youth programs. And we started with Gender Jam, which is for youth who are 13 to 19, and then added Little Rainbows about a month or 2 later, which is for folks who are 12 and under, and then started working on all the stuff for Gender Revolution 8, which is actually named by the youth who developed the program. I don't like the name at all, which is how you can tell I do youth-led programming.
Which, by the way, if people aren't familiar, it's GR8, right? So great. Right, so great, right?
So cheesy. It's just so cheesy.
I'm sorry, the other thing I wanted to point out that was really clever is, so we're at the Queer Community Clothing Collective, all spelled with Q's. So there's a lot of cleverness within this group of young people, right?
On that one as well. All about it. But that's how you can tell it's all youth-led, because if the adults just like sitting there going, this is stupid. But they love it, so right on, get it. And we try to make everything like that, all 3 of our programs, even the little young folks. Every week I'm like, cool, folks, what are we doing next week? And if they show up and they want to do something different, I'm like, cool, that's what we're doing. So I find that those programs are a little bit more sustainable because people have a lot more buy-in. The young people have a lot more buy-in. The adults who I pick or I interview or whatever, we choose to run those with me, find that doing youth work that way actually ends up being more sustainable because of the buy-in. And then when I've worked with parents, especially with the Little Rainbows, at first the parents will stick around for it because they're like, cool, you're new, we don't know you. I'm not leaving my 4-year-old gender nonconforming kid alone with you, even if I'm just next door at the cafe. I'm like, cool, hang out. And they'd see me do youth work, and they'd see me the way I interacted with the group, which is like half teacher, half youth worker with little kids, right? And there was kids who had like severe behavioral disorders that all of a sudden would just sit down and do programming with me. And the parents would look at me and they're like, what are you doing? We are in so many special ed programs and like have all these things written to trying to get that kid to do that at school. And I'm like, oh, because I asked them what they wanted. I treated them like a human being, treated them like they had some sort of autonomy, and I confirmed that they are gender non-specific or whatever they are, and didn't make a big deal out of it. And of course, you want to know why they're acting out at school? That's not a safe place for them sometimes. Why they're not doing anything? Oh, they're not being treated like a human being. They're being treated like a 4-year-old who's inferior. And we don't do that here. Everybody has autonomy, no matter what age they are. And that seems to work a lot better for our programming and why we have more and more people coming. I mean, I think when we started Gender Jam, the teen one, I think the first 3 weeks we had like 2 or 3 people. And now it's like 17 to 20, depending on the day. Oh my God. I know sometimes it's more than that. And then Little Rainbows, it can be anywhere from like 2 to 15, like little kids just running around. And then with the inclusion of Gender Revolution 8, because I refuse to call it great, because it's cheesy, they've started doing a lot more intergenerational events. So I think the first one that they did, we took over, there was like a family day at the skate rink. And we're just like, cool, trans takeover. We didn't rent it out. We're just like, nope, a bunch of trans people from like, I think the oldest one was like 67 and the youngest one was 1.5. And so this huge range of almost 200 trans folks and their family members took over the skating rink on a Sunday afternoon. And it was beautiful. So these are our experiences. Like, not only is it great to do this youth programming and great to do this outreach for healthcare for youth, for youth and adults, but to bring all of us together in a way that like our community doesn't get to do organically anymore is something that I think the youth programming has been awesome on focusing on. This is our second clothing swap, and then we also did a garage sale, and again, it just brought people together that usually they're like, oh, I think I've seen you around. Oh, wow. And it's like, that's one of the things that was our goal for the exchange, is that we can't really call ourselves a community center because we don't have the capacity to be open for programming all the time, but we are a community space. So people use the space, and more of these events that the youth are bringing together are making us more of a center and more of what we want to be. It's just trying to build up the The monetary capacity for that is very low, but the community buy-in is really, really high.
The TC Pride Podcast has been a production of Podletter Media and Twin Cities Pride. Subscribe now on iTunes or Google Play and submit your first Pride story at myfirstpride.org.